You're listening to Navigating Eldercare, where you'll find guidance and answers for every step of the eldercare journey. Each week, eldercare advocate Laura Daniels brings you expert insights and practical solutions to help families and professionals make confident care decisions.
Hello, my name is Laura Daniels, founder of Care Advocates and your host for Navigating Eldercare. For years, I have been helping families and medical providers, doctors, case managers, social workers, nurses, find the right solutions for seniors in transition, whether that is after a hospital stay, a rehabilitation stay, or when care needs at home have changed. We assist in finding the right care options. I started this work because I saw how overwhelming and confusing the elder process can be, and I wanted to be a guide and a resource for families and professionals. Each week on Navigating Elder Care, we tackle the real questions and challenges that families and providers face during care transitions. I have spent the last 30 years working as a registered nurse specializing in geriatric care, and I have dedicated my career to advocacy and care transition planning. This podcast brings together my experience and my passion to be able to support you on your care journey. In my business and in the work I do at Care Advocates, we walk alongside families every step of the way. We meet families, clients, and providers to create a customized care plan. When someone is needing care, assistance with activities of daily living, such as bathing, dressing, transfers, mobility, we provide options such as residential care homes, assisted living communities, memory care, and in-home care options. We advocate, guide, and educate throughout the entire process. Most importantly, we provide ongoing solutions and support. The care journey should never feel overwhelming. It should feel guided, supported, and understood. Welcome back to Navigating Elder Care. I am your host, Laura Daniels, and in today's episode, we are going to talk about caregivers in-home care. And today I am joined by a friend of mine, Mike Sandeja. He is the owner of Homewatch Caregivers. Mike was born and raised in San Antonio. He is a proud graduate of Central Catholic High School, attended Texas A&M University, and graduated with a degree in political science. Mike was commissioned as an Army aviation officer in May of 2000. He commanded units at the 82nd Airborne Division and the 101st Airborne Division, deployed to Iraq, Afghanistan, and Kosovo, and retired from the United States Army as a major in October 2020. Mike opened his Homewatch Caregiver business in San Antonio in January of 2021 with a desire to help our seniors and aging population to provide quality employment opportunities for individuals in and around our community. Mike is a volunteer at Our Lady of Grace Catholic Church, Central Catholic High School, and the San Antonio, Texas A&M Club. He is a board member of First Friday Network and Alamo Chapter Case Management Society, and he sits on the Texas Health and Human Services Aging Texas Well Advisory Committee. Mike is a certified dementia care specialist and a member of the Alzheimer's Association, and we're very happy to have him here. Mike, thank you for your service and for being here today.
Thank you, Laura. Appreciate it.
Mike, what inspired you to start an in-home caregiving agency?
I think first and foremost, I've got two aging parents. They're 76 years old. And as I was leaving the military, was kind of looking for that opportunity to, build upon 20 years in the military. And in the military, we talk about we care and provide for our most precious asset as a country, is our service members. And the transition, I feel like, was a natural one to now caring for our most vulnerable population, which is our seniors and aging adults.
Mike, can you define what in-home care is? And oftentimes it gets confused with home health, and we've talked about that on the show. Home health is when you are in a hospital or a rehab and you are discharged with home health orders. That includes physical therapy, occupational therapy, speech, and nursing. So in-home care, can you define that for us?
Sure. So in-home care is really your most basic care level that families can start with. Our caregivers are trained in supporting families with activities of daily living, and that can be anything from bathing, dressing, meal preparation, laundry, doctor's visits, things of that nature.
Mike, at Homewatch Caregivers, what services do you offer?
So as I mentioned before, the activities of daily living, that's where our caregivers really shine, is providing that extra set of eyes, ears, and hands in the home to provide, to support that loved one that's needing just a little bit more care sometimes, all the way up to working with families that maybe have a loved one with an advanced diagnosis. It could be Parkinson's, Alzheimer's, MS, ALS, and really what it encompasses is families will exceed the level of care that they're maybe receiving with that home health agency and need more care. And that's where they bring us in for those extra level, those extra hands, maybe sometimes around the clock.
Mike, who needs home care? Can you give us a recent example of somebody who would be an ideal candidate for caregivers at home?
Really, oftentimes it's maybe mom has had a fall in the home, and the adult children work a full-time job, both of them, or they can only provide limited support, and there's got to be someone there that is there to prevent those falls. It could be someone that has been recently discharged from a hospital, and they have some care needs that have to be followed up with post-discharge. Could be for a few days, could be for extended period, and that's where our caregivers come in, and our agency will provide that level of support.
And I know you and I have worked with a client for over a year now, client with Parkinson's and just very specific care needs. And you were able to help them at home, not just with ongoing education for that diagnosis, but also with the mobility and transfers. And that's one thing we love about your company, Homewatch Caregivers, is that you provide that ongoing education. We
do. And we work with all of the providers. A lot of times there's specific tasks in the home that must be followed. Our caregivers are trained to observe and recognize changes in conditions and report that to our staff so that we can share that with those providers as well as the family. The family, when you see a loved one day to day, you oftentimes don't recognize some of those changes, where our staff is able to identify and put things in place to further support that family member.
Let's talk about respite care, Mike. Can you tell us a little bit about respite care? We know it's a short-term stay. How do you help families when someone is needing just a few hours or even a week or 2 weeks of short-term care?
Absolutely. So many times that spouse or adult child that's taking care of a loved one, their life goes on too, and they have things that they have to accomplish, appointments that they have to meet. Maybe they have a work trip that's coming up. Our staff, our caregivers are able to come in from anywhere from a few hours to provide that respite to a few days to a few weeks and provide that opportunity for them to manage their day-to-day, because so oftentimes they put everything on hold to care for that loved one, and they need to get back to their daily living themselves and take care of those things at home that they need to. And that's where we come in and provide that support.
Or just to simply have a break. We know about that caregiver burnout. Mike, can you talk a little bit about that and how we know what that can do for that
Absolutely.
That spouse taking care of that person who's caring for their loved one?
You hit the nail on the head. The caregiver burnout is real. We talk about the plane example the other day. When you get on a plane, they tell you to put the mask on your face before you help other people. And in this situation, in caregiving, it's the exact same thing. Family members have to take care of their needs. Their burnout can affect the care that they're giving to that loved one, that parent, that spouse. And we want to be there to offset that burden and help them navigate that and, comfort the loved one so that they can get that respite they need.
Give us some misconceptions that families often have about in-home care.
One of the biggest misconceptions is that it's going to be a stranger coming into their home and they're not going to know who it is. And what we share with our families is, that caregiver team that's assigned to them, it's going to be just that. It's going to be a team, not a revolving door of caregivers, but individuals that know the family, know the person receiving care, know their pattern, what meals they like and don't like, where their favorite soup is located in the pantry, or which socks they like to put on in the morning. And everybody on that team is going to know that and be able to respond to those needs regularly. And you're not going to have to train a new person. You're going to have the folks that are there providing the highest level of care at all times for your loved one, making sure that they have all the support they need.
Mike, what sets your agency apart, Homewatch Caregivers? What sets you apart from others?
Well, first and foremost, when you call us, you're speaking to a decision maker. It's going to be myself or my alternate administrator, Jennifer. we are going to be the ones that respond to that call, and it's 24/7. We also work with families to provide short shifts. One of the biggest things that we talk about with families is that when you call us, we're licensed in the state of Texas. We are insured. We provide workers' compensation insurance to all of our caregivers, and that's to protect both the caregivers and the families. We want to make sure that they understand that service wraps around them completely, and we're there for them 24/7.
And you are locally owned, and one of the things I love is that if a family member calls you or I call you, your agency, someone is going to pick up the phone. It's not someone in Dallas or in a different city. It's actually a person
It is.
that knows the agency and the services that you can provide. Why should a family choose a caregiving agency company like yours, Mike, versus hiring a private caregiver?
As I mentioned before, the licensing and insurance are some of the first questions we get asked. The background checks are another thing. All of our caregivers are vetted very thoroughly. The other part of it is, as I mentioned before, life happens. And with the private caregiver, when their child is sick or their car breaks down, you're taking time off of work to go and take care of your loved one. Whereas, with a company like mine, you give us a call, or if we've identified it previously, we're going to have someone from our staff that also knows the family that you've already met that's going to come to your home and be that interim care until we can either get that caregiver to you or another member of the team to be in there in that replacement time. And
I know when I work with families and we refer to in-home care, what I often get asked is, what if they talk too much, or what if? So that's my question to you. How do you match caregivers with clients to ensure that there is that compatibility?
The first thing we look at is what skills are going to be needed. Because we have clients from all walks of life, from companionship to advanced diagnosis, we want to make sure that the caregiver's skilled properly for that level of care that's needed. And then from there, we move on to, are they the right person for that family? Some families want someone that's going to be engaging with mom or dad and talk a lot, or sometimes they don't want someone that talks as much. Maybe it's a meal preference. Those are the things that we look to match not just the skill sets, but the personalities for the families. And it's a simple call that, maybe someone's not working out so great, and we work someone else in and make those introductions and get the right fit until we do get it right.
Can you tell us a little bit about the onboarding process for your caregivers? How do you hire? How do you vet them? What does that look like when you're bringing them into Homewatch Caregivers?
Sure. So after a thorough vetting process with our applicants, we only invite the folks that we know can be a part of our team. We do all of the requisite background checks. We do onboarding in the office to include training. And that training stems from infectious diseases, hand washing, to utilization of the Hoyer lift that we do have in the office, transfers from the bed to the wheelchair, bed to a chair, gait belt use, numerous different things that we cover in office to provide the highest level of training to our caregivers. And from there, we follow that home. Every single home environment is unique. Not everybody has the same hospital bed or Hoyer lift or wheelchair. So we want to make sure that the caregivers coming into the home are prepared for that, and our staff follows them into the home, ensures that they're comfortable utilizing all of the equipment that's in the home, where the meals are prepared, where the special cereal is that maybe the family member loves, and they're ready to provide that care for that loved one.
So along with the onboarding process, Mike, how do you involve family members who you provide services to? How do you involve them in the care plan of their loved one, of that person receiving your services, caregivers?
So during our free initial consult with family, we develop a care plan. The care plan is part of our state licensing that we maintain, and it's updated on a regular basis with the family. And that care plan addresses all of the care needs to include medications, any type of mobility, whatever is specifically involved with that client. And we work with that family to make sure that we're capturing those things, updating them on any changes, as well as their providers that we're working alongside of. Again, it could be their primary care physician, it could be their home health agency. We want to make sure that, again, that family member's surrounded by that team and everybody's on the same sheet of music and tracking all of the progress as it occurs.
Mike, and I was in your office last week, and I met some of the caregivers. I got to see your board and all the different equipment that you use to help your caregivers with training. Can you give me an example of a creative solution that your team, your caregivers, developed to support a client? After I saw that, I'm wondering, okay, so what is all this for? Can you give us an example of how you utilize what you're doing in the office and how you supported a client?
Of course. So I'll give you one example where Sometimes a family member has been in the hospital or rehab facility for an extended period. They may not have been home, and nobody may have been home for several weeks to even a month at a time sometimes. Our staff can go into the home and ensure that the environment's going to be safe. It's going to be clean. We can change the sheets, clean the bathroom, clean up around the kitchen, make sure that maybe there's no expired food in the home, and that any equipment that's there, that it's still usable if they had equipment that is in the home. And our staff is going to ensure that prior to, that patient being discharged, with everybody's permission, of course, but making sure that, again, that they can make that transition home safely and, comfortably.
Mike, what is one of the most important questions that families should ask when they're choosing a caregiving agency?
So one of the first things they should ask is, how long does it take to get a caregiver in the home? And I will tell you, it can be as quick as maybe sometimes 2 hours. It may be a few more days from that. Again, what we want to do is make sure that we're matching the skills and all of the needs of the client with the caregivers that we have. The other thing that we want to make sure that families are aware of is that when they're coming into our services, that we're not obligating them to have a set number of days, weeks, or months. We're bringing them in to provide needs or care for their needs, and it's going to be on their basis. We're going to discuss all of the service agreement arrangements that are put in place under the care plan, and until they're comfortable with that, make sure that they know that they're getting that highest level of care.
Mike, let's talk about something that your agency is really good at, and that is the first 72 hours at hospital to home care. When a patient is leaving a rehabilitation facility or hospital, we know that the first few days are crucial. We know the numbers. We know that hospital readmissions rates are significantly reduced with patients who receive a caregiver at home, professional services at home, when caregivers are supporting that patient at home after a discharge. Can you tell us a little bit about how your agency does that so well and how you help families with the first 72 hours?
So our goal is to ease that transition. We help reduce the stress of recovery, and we're lowering the risk of readmission by creating a safe home environment. We're going to offer medication reminders, and we're going to provide hands-on help needed for healing and comfort of that family member at home. As we talked about with the readmissions, we want to make sure that there are no readmissions if possible. And, our readmission rate in the last 5 years is less than 1%, which is a testament to the work that our caregivers do in the home in making sure that that transition is as smooth as possible. We're communicating to the family all of the progress and changes that are occurring and following those doctor's orders home with that loved one. One of the things that we work towards is speaking with the providers while they're still in facility. What does their rehab process look like? What exercises are they wanting them to continue at home? And so we can carry that home. We had a family member that was discharged with those instructions to do certain exercises and rehab at home. And we cover those with the caregiver, show them those techniques. Our staff is meeting with the rehab therapist and able to transition that there. And again, ensuring that the medication reminders are occurring. That family member had a very specific set of medications based on times, amounts, and we're able to track those things as well as some vital signs to give that feedback back to the providers and ensure that we're meeting those expectations with the provider, the family, and matching all of those things on the progress notes to everybody.
So you don't just service the family and the client, you're coordinating care with the entire team, correct?
It's a full spectrum of care.
Mm-hmm. Mike, tell us a little bit about what does the contract look like? Are there minimum hours? Can you speak a little bit about that?
Absolutely. So I mentioned earlier, it's a service agreement. There's no contractual obligation for families. When they call us and we review that care plan and that service agreement with them, we are very explicit with that, saying this is a service agreement. And as your needs change, we will meet that change with you. We meet you where your care needs are. So if those care needs start with a day and end up with 24/7 care, it's a simple phone call. And, in most cases, and what we hope for really is that you don't need us and maybe things have gotten better and you call us and say, hey, let's go from 3 days a week to 1 day a week and, see how things progress from there. It's a simple phone call. Again, we meet you where your care needs are.
Last week, we spoke about aging in place and how to successfully and safely being able to do that. And one of the resources is having in-home caregivers in your home that can assist you with mobility, transfers, everything that Mike spoke about. Mike, can you tell us a little bit about, it's obvious, right? We know that caregivers can go into the home. Where else are you able to service clients and families that you care for?
So our caregivers can go anywhere where that family member is. We work in assisted living facilities, independent living facilities, 55 and older communities. Really, again, we can meet the family wherever that family member is living. And one of the things that we actually like to do is, especially when we know that it's going to be a discharge, is start that care, even for just a few hours in the facility, so that, again, we're working alongside those providers. We're learning that routine, those exercises, the medication schedules. We know what those look like, and it's there in the facility under supervision, and we can carry that care home with the family.
So you bring up a good point. Not just is that when somebody's leaving a rehab or a hospital, you can assist and serve that patient at home, but you can follow that care into assisted living.
Correct, yes.
Okay. Mike, if you could just leave families with one piece of advice about how to prepare for navigating in-home caregiving, what would that be?
I think the journey starts now. Really, it probably started yesterday. Laura and I, you and I have talked about how, we have real estate agents and financial advisors, even insurance agents that we have on speed dial and we communicate with regularly. I believe firmly that, we should have those resources that we know we're going to need at some point. That relationship built years in advance, ideally. But you don't want to have that 911 call when, the case manager tells you that you're being discharged tomorrow and it's a Friday afternoon at 4:00 and you're looking for care. You want to have that person that you've built a relationship with, that you trust. You maybe even know their family, a little bit about, where they come from. That's the trust that you want to have in that agency, that provider that's going to be following you home into, that sanctuary.
Mike, I shared this with you in what I do, assisting families with care options. 95% of those that call, it's now, they need that care now, whether it's in-home care, assisted living, memory care. So it's good to kind of think ahead and have that plan so that you know what your care is going to look like and not wait until an emergency, so that you're able to plan and make phone calls, get references, just know who you're going to have in your home if you were to need in-home care. Absolutely.
It's absolutely critical. You don't ask your financial advisor to make you a millionaire overnight. So, do the due diligence and, start the process now and, build that team around your family. And when you need it, they'll be there.
I agree with you. Just having that plan and not waiting until the last minute. And if you ever need caregivers, you're going to know who to call and not do it in a moment of anxiety and when it's so stressful to be in a hospital and that you have to go home now. Just having that plan ahead of time. Mike, how can families and our listeners get a hold of you at Homewatch Caregivers?
So first and foremost, you can call us at 210-346-1172. That's a direct line to our office, and everything's forwarded to either my cell phone or my Director of Client Services phone 24/7. So whether you call us at 2 p.m. or 11 at night, someone's going to be there to answer you live on the phone that can make decisions and help advise you. You can look on our webpage. It's hwcg.com/San Antonio North. And that's the best two places to find some information about our services. And again, feel free to give us a call anytime.
Mike, I want to thank you for being here, for educating us on in-home care and what that looks like, and for sharing the passion that I share and that everyone here on the show shares, is serving our elderly population. Thank you for all that you do.
Well, thank you for having me. It's amazing to work with folks like yourself, and I appreciate the opportunity. Thank you.
You're welcome. If you want to get a hold of Mike at Homewatch Caregivers, you can give him a call at 210-346-1172. Thank you for joining me on Navigating Eldercare, where we bring guidance and answers for every step of the eldercare journey. If you are a family member, hospital case manager, or healthcare provider, and you know someone facing a change in their health or planning for future care needs, Care Advocates is here to help you find the right care at the right time. Whether it's assisted living, memory care, or in-home care, or just bringing in trusted resources into your home, we walk alongside you every step of the way. We At Care Advocates, we'll meet you at bedside. We'll create a customized care plan. We can discuss care options that fit your needs. We provide ongoing solutions and support. Our commitment is simple: care, compassion, lifetime support. For a free consultation, you can call me at 210-669-2222. Be sure to subscribe, like, and share this podcast, and visit us at advocatern.com for helpful resources. If you have a question or an idea for a future episode, you can email me at Laura, L-A-U-R-A, at advocate, ADVOCATERN.com. You can also listen to us on past episodes on YouTube or listen to us on your favorite podcast application. You can also listen to us here every Sunday at 8:30 on 9:30 a.m. The Answer. I am Laura Daniels, and this has been Navigating Elder Care, helping you find the right care at the right time for the people that matter the most. Thank you for listening.
This has been Navigating Elder Care with Laura Daniels, providing guidance and answers for every step of the elder care journey. For a free consultation, call 210-669-2222 or email Laura at advocatern.com. Catch every episode on 9:30 a.m. The Answer, YouTube, your favorite podcast app, or at advocatern.com.